Autism has become a big problem in the United States. The latest data from the Centers for Disease Control indicate that autism spectrum disorder is diagnosed today in one child out of every 110 children in the United States. CDC data also indicate that attention deficit disorder, ADHD, is diagnosed in 14 or 15% of children. So these problems, which collectively we call neurodevelopmental disabilities, have become very common in American children. The question comes up, is the increase real or is it better diagnosis? And I think the answer is it's probably a combination of the two. There's no question that there is better recognition and better diagnosis, but when you talk to pediatricians who've been in practice for the last 30 or 40 years, teachers who've been in the classroom for 3 or 4 decades, it's clear when you talk to these people that have an accumulated body of experience that there's been a real increase, and that's borne out by the best statistics. Now, what are the causes of autism? Well, there's clearly a genetic component. Dr. Joseph Buxbaum, who's in the Department of Psychiatry at Mount Sinai, has been a leader in discovering genetic causes of autism and autism spectrum disorder, and he and I now think that probably 35 or 40% of cases of autism are genetic. But the evidence is also beginning to build that there is a substantial fraction, we still don't know the exact number, of cases of autism and other learning disabilities that are due to chemical exposures, especially chemical exposures very early in life. There's really 2 lines of evidence that bring us to that conclusion that chemicals contribute to learning disabilities. The first is that there have been a whole series of studies which show that the developing human brain is exquisitely sensitive to toxic chemicals in the environment. We know that lead, methyl mercury, PCBs, which are polychlorinated biphenyls, certain pesticides, certain plastics chemicals can cause learning disabilities in children. We've learned this through careful studies of human babies whom we followed over the years, and then the studies in human babies have been buttressed by animal studies in the laboratory. The second line of evidence is that research has shown that there are several classes of chemicals that can directly cause babies to become autistic. It's been shown that exposure of the human fetus in the 6th or 7th or 8th week of pregnancy to a medication called thalidomide can cause autism. There's another drug called misoprostol, and there's a third drug called valproic acid. If exposure to any of those takes place in the first trimester of pregnancy, there's a high rate of autism. None of those particular drugs that I've just mentioned are driving the autism epidemic. None of them are very widely used in this country. But the fact that they can cause autism demonstrates proof of principle that chemical exposures in early life can cause autism. And so it's on the basis of these 2 lines of evidence, the recognition that the brain is exquisitely vulnerable to toxic chemicals, the recognition that certain classes of chemicals can cause autism. That's why we have launched the Autism and Learning Disabilities Discovery and Prevention Project at Mount Sinai. Well, there's been a great deal of talk, especially on the internet, that vaccines cause autism. And in response, and that perception arose from the observation that there have been these terribly sad cases of children who receive a vaccine and then 2 or 3 days later, or even the same day, develop symptoms of autism. There are cases out there where this has been observed. As a consequence of those observations and the great anxiety that parents develop, very justifiable anxiety that they developed in the aftermath of those cases, researchers around the world have undertaken studies to look at the possible links between vaccines and autism. In this country, the Centers for Disease Control has done studies. Studies have been done by researchers in England, in Scandinavia, in Japan. There have been a total of 12 or 15 studies around the world that have looked at the question. None of them, 0, have found any hint of a connection between vaccines and autism. These studies have looked at specific vaccines and found no connection. They've looked at combinations of vaccines and found no connection. They've looked at the vaccine preservative, which is called thimerosal, and found no connection. It's just 0 for 15. I think it was a valid question. It was a question that was motivated by genuine concerns of parents. But I think it's time to move beyond vaccines. It's time to look for the real environmental culprits and not waste further time and energy looking for some illusory connection between vaccines and autism. A further consequence of the worry about vaccines and autism is that a substantial number of parents are not getting their children immunized, or they're delaying immunization of their children, or selectively doing some vaccines but not other vaccines. This is, as a pediatrician, I must tell you that I find this very worrisome. We're seeing epidemics of measles. We haven't seen measles in this country for years. We're seeing epidemics of whooping cough. A lot of younger parents who grew up in the era of vaccines have never had first-hand experience with these diseases. They don't know how terrible these diseases are. They don't know that 1 child in 10 who suffers measles develops pneumonia, that 1 child in 5 becomes deaf, that 1 in 500 dies. These are terrible diseases. The vaccines were developed to save lives and protect children's health, and there's a real cost to not getting children vaccinated.